Welcome to today's episode of AudioBoards. Today, we're diving into the classification of personality disorders and the available treatment options. Shall we begin with the classification?
Absolutely. Personality disorders are classified based on predominant symptoms and their severity. Let's start with antisocial personality disorder, which is characterized by selfishness, callousness, impulsivity, and frequent legal problems. These individuals often struggle with following social norms and can be manipulative. Think of a career con artist, someone who deceives others without remorse.
Exactly. Then we have avoidant personality disorder, where individuals fear rejection to such an extent that it leads to hypersensitivity, poor social endeavors, and low self esteem. For example, a person may want to attend social gatherings, but avoid them out of intense fear of judgment. Moving on to borderline personality disorder, this one is complex. It involves impulsivity, intense relationships, emotional instability, identity confusion, and suicidal tendencies. Many individuals experience frequent emotional highs and lows, often feeling empty or disconnected. Up to 80% of hospitalized borderline patients attempt suicide at some point, making this a serious condition.
That's right. Another disorder we often see is dependent personality disorder, which presents as extreme passivity, an inability to make decisions, and a lack of self confidence. These individuals often rely excessively on others for guidance and approval. Then there's histrionic personality disorder, characterized by dependency, immaturity, seductive behavior, and emotional instability. A person with this disorder might constantly seek attention and validation in dramatic ways.
And speaking of attention seeking, narcissistic personality disorder is next. It's marked by grandiosity, a preoccupation with power, and excessive demands for attention. These people often lack genuine empathy for others and may exploit relationships for personal gain. In contrast, obsessive compulsive personality disorder, which is different from OCD, includes perfectionism, rigid thought patterns, and a need for control. They tend to struggle with flexibility and spontaneity. Paranoid personality disorder features extreme defensiveness, secrecy, and suspicion. These individuals may believe others are constantly trying to deceive or harm them, making trust nearly impossible. Schizoid personality disorder involves extreme introversion, social withdrawal, and a lack of interest in relationships. They are often seen as loners who prefer solitude over human interaction. Lastly, schizotypal personality disorder includes superstitious thinking, eccentric behavior, and limited interpersonal ability. Their odd speech patterns and beliefs can make social integration difficult.
Now, let's discuss treatment. In severe cases, especially when there's a risk of harm, hospitalization is necessary. Otherwise, treatment can be managed in day treatment centers or self help communities.
Yes, structured environments that emphasize peer relationships and repetition can be particularly beneficial. Early intervention is key, especially in schools and homes, where behavioral techniques can be applied to modify harmful patterns. One of the most effective therapies for borderline personality disorder is dialectical behavioral therapy. This approach blends mindfulness with cognitive behavioral strategies to help patients regulate emotions, improve interpersonal skills, and cope with stress. Psychological interventions can take place in both group and individual settings. Group therapy helps with interpersonal skills, while individual therapy should initially focus on stabilization before delving into deeper psychological exploration.
Absolutely. Long term approaches like psychodynamic psychotherapy, transference focused psychotherapy, mentalization based therapy, and schema focused therapy can be helpful. However, therapists must navigate countertransference carefully and maintain professional boundaries.
On the pharmacotherapy side, while medications are not a cure, they can alleviate symptoms. Antidepressants like fluoxetine or sertraline can help with anxiety and depression, especially in borderline personality disorder. Yes, antipsychotics like olanzapine or risperidone can reduce hostility and agitation, while anticonvulsants such as carbamazepine or lamotrigine may assist with behavioral dyscontrol. For schizotypal personality disorder, antipsychotics can be beneficial, while those with avoidant personality disorder may benefit from anxiety reducing medications like SSRIs and benzodiazepines. Before we wrap up, it's important to note that the prognosis varies. Disorders like antisocial and narcissistic personality disorder tend to have a poor outlook since engagement in therapy is often limited. Those with a history of parental abuse or mood disorders typically face the most challenges in treatment. Thanks for joining us today. That's all for today's episode. Thanks for listening to AudioBoards. Stay tuned for more educational content in our next episode. The views and opinions expressed on the AudioBoards podcast do not necessarily reflect those of our employers. This podcast is for educational purposes only and should not be used to diagnose or treat any medical conditions. It is not a substitute for professional medical advice. Always consult a qualified board-certified healthcare provider for any medical concern.